Right now at 11, we have a look at the latest coronavirus numbers across the state. They show our daily positivity rate is now at 4.3%. In the past 24 hours, 9 more people have been hospitalized. Now, the Northeast is becoming a bit of a COVID hotspot again. In fact, several states here, including Connecticut, have the highest number of COVID cases per capita in the past 7 days.
Not the news we want to hear, that's for sure. Channel 3 Eyewitness News reporter Sharon Johnson spoke with health experts about what's causing this latest trend. She is joining us live from the State Health Lab with more. Sharon.
Well, Mark and Aaron, experts point to the number of COVID variants here in the state right now. Right now, we're dealing with the UK variant, we're dealing with the New York variant, as well as strains from South Africa, Brazil, and California. Now, the UK variant is the one that's the most prominent here in Connecticut right now that could be contributing to the increase we're seeing.
The continued relaxation of prevention measures while cases are still high, and while concerning variants are spreading rapidly throughout the United States, is a serious threat to the progress we have made.
And the Northeast is seeing the impact. According to the CDC, New York, New Jersey, and Connecticut are among the top 10 states with the highest number of new cases per capita in the past week. In Connecticut, the numbers aren't as bad as last spring or even this January, but cases are inching up even as vaccinations continue.
A combination of more transmissible variants plus some relaxing of guidelines combined with COVID fatigue have contributed to a real increase in.
University of New Haven Dr. Summer McGee says there's a concern over the New York and UK variants, especially since both are more infectious. McGee says she's concerned that relaxed restrictions plus the emerging variants may cause another spike.
We may see COVID spikes that are really rapidly increasing before we can get to real herd immunity in our state.
Hospitalizations have been declining in the state. Doctors say that's because more young people are contracting COVID. Deputy Director at the Jackson Lab for Genomic Medicine, Mark Adams, says so far, the vaccinations have proven to do a good job against the variants.
Evidence that's available to date is that the vaccines are still mostly effective against the new lineages.
Health experts suggest people get signed up for a vaccine as soon as possible. While they're waiting, they suggest continuing to wear masks, social distancing, and limiting interactions outside of your family or personal bubble.
That light's at the end of the tunnel, but we're not there yet.
And some health experts are concerned that the U.S. could experience a third wave like what we're seeing in Europe right now. Right now in Europe, there are some countries that are experiencing a new lockdown because of a surge in cases. Live in Rocky Hill tonight, Sharon Johnson, Channel 3 Eyewitness News.